Hi, I'm Dipesh and I'm here to talk about MURs. As you'll be aware, MURs are one of the community pharmacy advanced services, and it's also provision of MUR or NMS is one of the great gateway criteria in order to qualify for doing the policy payment work. And this video is all about supporting you to maybe provide MURs if you're not, and actually give you some key strategies to deliver MURs within your pharmacy. So as a pharmacist, for me, I find being proactive is key. And having a style that's really personal for your patients, it helps develop that rapport, but it also helps you think about actually, there is a patient on the end of it. And if we're giving some advice, we make it personal to that patient. And one of the things I found really useful was to do the CPP consultation skills package. It helped me to change my consultation style a little bit and amend the style of questions I was asking to help me get the most out of that MUR, help the patient open up a bit more and put the onus on them, and actually together develop that patient-centered approach, which I find is really useful at developing that engagement with them. Equally, it's really important that as pharmacists we are proactive and that we utilise things like bag stuffers, patient letters, if a prescription's on the shelf, making sure they're flagged for MURs so that you're not having to check when they come in if you're busy. Is this patient eligible? Are they not? And you may lose an opportunity to make a significant intervention for that patient. Equally, having your staff on board is quite key. Regular training session, the value of an MUR. Give some examples of really good MURs that you've done. My staff have found it really useful when I've told them, oh, I did this for this patient, or we come up with this plan and this is what's happened from it, or we started this and the patient wasn't taking this even though they were ordering it. And they find it really useful and they see where they fit in to the actual delivery of care for the patient as well. There are some target criteria within MURs. So 70% of our MURs have to be within target groups, which includes patients who are on normal medicines, on antiplatelets, on anticoagulants, and these are the kind of patients that we see every day who actually may need more support. Diabetic patients are on there, and patients who have been in hospital but actually been discharged within the last 8 weeks with some changes, they may need some support because you may have seen them previously, but actually with all the changes that have been taken place, they may need some help in understanding that as well. And for me, I found it really useful because it gives me a positive perception of an MUR and actually what we can do as pharmacists and how we fit into the role of long-term condition management. And it also empowers the patients to take a bit more in charge of their care. Even if there's no key recommendations that come out, having that conversation with that patient around the indication of the medication and some key health promotion messages really can impact on the health quite greatly, and possibly impact on an hospital admission or just give them some better power of their care. And I think as pharmacists we're vital in that process, and I found MURs really useful. And although it's had negative press, I think my patients see the benefit when they come in for an MUR because we're explaining why we're doing it and the power of it, but also making those recommendations for them as well.